This week with members of the White House Coronavirus Task Force, and we've continued. We've continued to be on the same mission we've been on throughout the course of this year, and that is to save American lives, and to work every day toward that day that we put the coronavirus in the past. I'm joined today, and you'll hear in a few moments from members of the White House Coronavirus Task Force, including those that are leading the effort of distribution, vaccinations under Operation Warp Speed. And I think you will be as impressed as I was at FEMA earlier today when I heard the detailed plans for the virtually immediate distribution of vaccines when they become approved and available to the American people. From very early in this pandemic, at the President's direction, we have followed an approach to this pandemic that was federally supported, state managed, and locally executed. And to that end, this past Monday, we completed our 41st conference call with all of the nation's governors, every state, every territory. There we spoke about our current circumstances where we see cases and hospitalizations rising, but we also continue to speak to them about the expansion of testing, the availability of supplies, and our ongoing efforts to continue to drive forward toward the development and the distribution of a vaccine for the American people. As we gather here today, with cases and hospitalizations rising across the country, President Trump directed us to host this briefing to describe the ongoing work of our task force and our partnership with state and local officials and our partners in the private sector to continue to put the health of America first. But first, let me begin simply by saying that our hearts and our prayers are with all of those families that have been impacted by the coronavirus over the course of the past 10 months. And let me say personally, not a day has gone by that I haven't thought personally about families that have lost loved ones. And I want to assure each of you that you will always be in our hearts and you will remain in our prayers. But we wanted to take this opportunity also to thank the American people for the extraordinary sacrifices that you've made over the course of the past 10 months. We've been through a lot together. We went through 45 days to slow the spread back when the positivity rate across this country was more than 20%. We managed to accomplish our objective. We slowed the spread, we flattened the curve, we saved lives. And then during the outbreak across the Sun Belt this summer, when we saw positivity rise to nearly 10%, the American people, officials at the federal and state level, stepped up again, and we put that outbreak in the past. And even as we see help on the way, vaccines being developed at a historic pace, as I mentioned before, as we gather today, we are seeing cases and positivity rising across the country. But we approach this moment with the confidence of experience. We know the American people know what to do. We have forged a partnership that is truly seamless with state and local health authorities. And as we'll describe to you today, we've continued to work 7 days a week, all throughout this year and up to this very moment, to make sure the American people have access to the health care that we'd want any member of our family to have as we meet this pandemic. Now, cases are rising throughout the country. Positivity in the last 30 days has risen from an average of 5% to 10%. And to that end, we've continued the mobilization that began at President Trump's direction early this year. We increased testing from a standing start in the month of February to now. As of today, we've completed more than 170 million tests, and we continue to approve new tests, including an at-home test that the FDA just recently approved, and we're distributing more than 150 million Binax tests to schools and nursing homes around America as we speak. Our mobilization of supplies, you will hear described in great detail, continues to surge each and every day. We actually are able to track PPE and supplies on a hospital-by-hospital basis. And so we're carefully monitoring, we're working with state officials, with hospital administrators to make sure that our hospitals have the support they need. Also, as we gather, more than 140 clinical trials for therapeutics continue to be underway, but effective therapies are already available that are widely known among the American people. And for those over the age of 70, we're proud to report that we actually have decreased the fatality rate by more than 70% since those heartbreaking days of April. In May of this year, of course, as the President spoke last week in the Rose Garden, we launched Operation Warp Speed, focusing on accelerating the development, the manufacture, and the distribution of a safe and effective vaccine. And you'll have an update today on the progress from two of our leading experts and those that are coordinating Operation Warp Speed. What I want to say in the midst of all of this to the American people as we begin this briefing is that with the massive increase in testing over the last 10 months, with PPE and medical supplies and equipment that are available to the American people, with the medicines and the therapeutics, and very soon the vaccines that are available, America has never been more prepared to combat this virus than we are today. But our pledge to each and every American looking on today is we're going to work around the clock to keep it that way. We're going to make sure that hospitals that are seeing patients coming in on an increasing basis know that we're going to work around the clock to meet that need. And you have our continuing pledge and the practice of experience that we've had along the way. So in a few moments, you'll hear from members of our team. We're going to begin with Dr. Deborah Birx, who's going to describe what we're seeing in the rising cases. Literally every day for members of the task force begins with detailed analysis of what's happening across the country, and she'll give you our very best information on rising cases and hospitalizations. That information is summarized each and every week for the nation's governors and provided to them in particular detail as well. After Dr. Birx speaks, we've asked General David Sanford with FEMA to provide an update on our ongoing efforts to provide PPE and medical supplies to our hospital needs. We're literally going to make sure, as I said, that as we see cases rising, that we're meeting the needs in hospitals around America to stand up the response that any one of us would want a family member to be able to have access to. Then we've asked Dr. Fauci to give us an update on the incredible and historic progress on the development of vaccines. It seems like with good news happening every couple of days, that's a great encouragement to the American people. And then General Gus Perna will outline our distribution plans on Operation Warp Speed. I was at FEMA today, received a detailed briefing about our distribution plans, and I asked General Perna to come here today to make that presentation to the American people, and it is in a very real sense putting us in a position that literally the day after one of these vaccines is approved, we'll be shipping vaccines to the American people, and within a day after that, we'll be seeing those vaccines injected into Americans, with a particular focus on those most vulnerable and those that are providing health care to the American people. Finally, we'll talk with a bit about the way forward as state and local governments are continuing to act and take mitigation measures to slow the spread. You can assure them, as we did governors again this week, that we'll support decision-making at the local level. And we'll continue to support decisions that are made in each individual community based on the circumstances on the ground. But that being said, President Trump wanted me to make it clear that our task force, this administration, and our president does not support another national lockdown. And we do not support closing schools. You'll hear from Dr. Robert Redfield of the CDC that actually the CDC never recommended that we close schools at any point this year. And Dr. Eleanor McCants-Katz, who is also serves with substance abuse and mental health services at HHS, will describe the real costs to children being away from school. But in every one of these cases, we're going to give you the best information that we have up to this moment. And I just want to assure the American people, as I trust that you will have a sense today, that we're going to continue to work around the clock to meet this moment. But help is on the way. We have every confidence that in a short period of time, we could have one or more safe and effective vaccines for the American people. And as each of us does our part in partnership with state and local officials, each of us does our part to look after our own families and our own communities. I believe the day is coming soon when we will put this coronavirus in the past.
Shepard Smith here. Thanks for watching CNBC on YouTube.